simple extraction, Lauryssa NWC. So first you're going to go ahead and seat your patient. You're going to review your health history form and make sure that everything is correct. They don't have no questions, no new medications, surgeries, anything that would be concerning. Then you're going to explain the procedure to them. And once they understand what they're getting and all questions are answered, you're going to have them sign the consent form. And once the consent form is signed, you're going to take their vital signs. And then you're going to give post-op instructions before and after. Since this is a surgery, you don't know how they will act after. So you give it before and after. Next, you're going to place topical anesthetic right there with your cotton tip applicator. Then once that is placed and you load the syringe for the dentist, he's going to place the local anesthetic right there. And then in time, he's going to come back and check to see if the area is numb. With the Explorer, he's just going to go ahead and poke and feel around the gums of that area and ask the patient, do you feel this? And once the patient is numb, the dentist will go in with a perio still under the gums to deattach ligaments and make room for the forceps. So you're going to go ahead and bring the side underneath the gums and just wiggle around and, to deattach it. Then the dentist will use a straight elevator in between the tooth to luxate. So he's going to put this in between the teeth and just wiggle back and forth, up and down, luxate to get it loosened. Then the dentist will use a forceps. It's depending which one he wants, which tooth you're doing. Each dentist has their favorites, but here's the forceps right here. He'll use it to remove the tooth in one piece. That's always the goal. You don't want it broken up. You want to try to get all the nerves and all the gum all in one. Once it's removed, he will use a surgical curette to remove any remaining debris or infected tissue. And while using this, sometimes he'll want you to aspirate with the surgical aspirating tip to remove blood if dentist asks for it. Because sometimes he might not want you to because he wants that blood to build up to build a clot. Then you will place a gauze on the extraction site. The patient will need to bite on it and apply pressure for 30 minutes at least. Your cotton gauze, and then they're biting on it. Then you're going to repeat post-op instructions and give a printed out sheet to them. Because once again, you don't know how they're going to act. You don't know if they're going to listen or even remember. And it's good if they brought someone, you could tell them, give them the paper. Or the post-op instructions. And then you release your patient.